So, good day everyone, and to you, ma'am. So, according to what I understand from the article entitled, What Should Surgeons Explain to Their Patients? So, in modern medicine, a surgeon is a medical professional who performs surgery. Although there are different traditions um, in different times and places. A modern surgeon usually is also a licensed physician or receive the same medical training as physicians. The same with us as a student nurse. Before we get our professional license, we need to do trainings and study hard for us to get it. And the same with the surgeons, they need to become an expert and eligible, specializing in surgery. And based on the article, it says that the concept of the surgeon is that as someone who considers that the least the patient knows, the better for all concerned. Dates from a time sometimes called the era of the surgeon, when it was the surgeon who dominated the patient or doctor relationship, and this situation was generally accepted by patients and family members as well as by society in general. This change in the surgeon-patient relationship has not led to any improvement in communication between two parties, since the expectation and desires of patients do not in general coincide with those of the surgeon, in spite of the fact that the physician is seeking the best solution for the patients. So usually society, family members, and the patients themselves have an unrealistic expectations, almost always exaggerated, concerning the real benefit of surgery. And what often happens is that the patients does not altogether share the surgeon's satisfactory. So a lot of patients they have a big expectation toward the surgeons, which is um, surgeons can't do miracles. They just do their best scientifically, but they can't um, they can foresee the future for this surgery. So more able surgeons tend to suspect that the solution to this problem at hand lies in anticipating the wishes of the patients. But some of these may not be foreseen, as what I've said. One of the most common desires of people who had surgery is that the surgeons should explain to them how the operation went and why they have drains or drips or other postoperative aids. It's what we call health education. This dialogue is, however, often cut short because the patients are being monitored by other doctors. So the doctors are not consistent of their patients. So every every time there's a lot of doctors who will going to check every patient. So it will so it was being monitored by by other doctors, so who have not operated on them. The situation becomes more difficult if the surgeon on call, a doctor whom the patient has just met, decide that a second intervention is necessary. The operating surgeon should explain this. So the operating surgeon will going to explain the circumstances to the patients in pre-operative sessions. So they are the one who are obliged to explain this to the patient. Moreover, it is very important that the patient also be introduced to the surgical team. and understand their different roles in relation to his or her case. Such communication serves the quest for excellence.